Together with Matthijs Botman and Tom Hendricks, we conducted this review on short-term reconstructive surgical missions in low and middle-income countries. If we take a look at what these missions mean to the global surgery world, they have an important role. They aim to meet the needs of underserved populations. And as we heard, 5 billion people worldwide lack access to basic surgical care. There are a couple of surgical conditions that make up 1% of the global burden of disease. The first three are those conditions: facial clefts, burns, and NOMA. If we take a look at the surgically treatable conditions, they make up 3% of the global burden of disease. Missions, however, are surrounded by controversy, often topic of debate, and up until now, there is no systematic review on these missions available. So this was the reason for our review. And if we look at the controversy and debate, the reason is that there is a lack of evidence in effectivity of these missions. There is a lack of evidence in safety of these missions, and furthermore in training activities. So the key aspects of our review: we found 41 eligible studies. We focused on 4 main outcomes: basic patient characteristics, patient safety with regards to complication rates, health gains, and sustainability. Our conclusion is, like with the research of Nathan, the evidence is scarce, and the strength of the review is limited because out of the 41 eligible studies, 37 were case series. Only 4 were economic studies. There is a huge amount of reporting bias, and what we did find is there is a correlation between sustainable missions and their follow-up. So longer follow-up means better better rate of sustainability. So if we take a look at the future of these short-term missions, how can we keep them of value for the global surgery world? Well, we need to have sustainable partnerships, and to achieve that, a huge part, an important part, is to incorporate research. As I mentioned before, long-term outcomes are really important, so a long-term follow-up, which is really difficult, but is going to make a huge impact on keeping these missions valuable. The effectiveness of training activities, training of young doctors, but training of clinical officers as well. And most importantly, to improve accountability. There are a lot of organizations that conduct these missions in low and middle income countries, but there is a lack of accountability. If we improve that, we're going to improve the value of these missions in low and middle income countries. Thank you.